Welcome to Fishing Without Bait, a podcast about living life without definitive expectations, where we assist people in exploding into their life through full impact mindfulness. We're looking to help people create their lives rather than find them. There's no admission fee, only the honesty, open mindedness, and willingness to try. As usual, we offer an eclectic roster of guests, and if you've been viewing social media, there seems to be a plethora of individuals who, although well intentioned, seem to believe that they have some solutions and advice for the continuing and burgeoning mental health crisis, not only in this country, however, the world. So, we've often thought that a little bit of knowledge can certainly be dangerous. And merely because you have the best of intentions or you've had some experience with mental health issues yourself, please do not be offended. However, that does not qualify you necessarily to assist others. I can watch as many medical shows as I possibly can. However, that doesn't qualify me to diagnose and treat illnesses. Merely because I could be a spectator in an operating room does not make me a surgeon. Watching a car mechanic does not make me a mechanic. So today we're joined by Adriana, who is a colleague of mine. She's a colleague in training from the Indiana University of Pennsylvania. Welcome, Adriana.
Hi, thanks for having me.
Tell us a little bit about yourself and the calling that you had to obtain the necessary training and experience to assist people to help them help themselves.
Sure. I grew up in Philadelphia and I decided to go to Indiana University of Pennsylvania to pursue my bachelor's degree in psychology. So I graduated with my bachelor's degree in 2018. And what kind of led me into to being interested in that field was experience in my family with struggles with mental health. And as you mentioned, this is not just a crisis in our country, but it's a crisis all over the world. So I really wanted to be able to help others, which led me into pursuing my master's degree, which I started in 2019, also at Indiana University of Pennsylvania. So I'm currently pursuing clinical mental health counseling. With my projected graduation this December. So yeah, I'm very excited. And
So, how does a young lady who grew up in Philadelphia on the eastern side of Pennsylvania end up in Pittsburgh, Pennsylvania on the western side of the state?
well, as I mentioned, my own family had their own struggles with mental health, and I decided that what was best for me and my own mental health was to put a little distance there. So I ended up moving out to Pittsburgh, where I met my fiance, and so I'm enjoying the Pittsburgh life now. Assimilating as best I can.
Yeah, that's quite a dichotomy between Philadelphia and Pittsburgh.
Hmm.
However, as growing up, as most people have been affected either directly or peripherally by someone in their circle with either mental health and or substance use issues, I don't think there's any family that can honestly say that they haven't been affected by that. Tell us how that affected you. We always talk about how it affects the individual, very little about how it affects the people, their loved ones.
Well, yes, certainly there is a ripple effect throughout a family that's affected by mental health and substance use. So it was tough growing up in an environment like that. I still, struggle with certain things to this day. Um, but it really inspired me to want to get involved with this community to learn what I could do to help others that are struggling with mental health issues and or substance use. As you know, most of the time those two overlap. So.
Yes, it's often said that substance use, depression, anxiety walk hand in hand down the street and hug and kiss on the corner. So that led you to a degree in psychology. So tell
Yes.
us a little bit about your experiences and the training of an undergraduate degree in psychology, Adriana.
Um, I it's kind of interesting looking back at just how little I learned in just studying psychology. I think we had one course on developmental, we had one course on abnormal psychology, which is, mainly just like disorder focused. Lots of research. So realistically, when I entered the job market in 2018 after I graduated, I had little to no understanding of what I was really getting myself into. Um, I had read about these disorders, I had taken tests, but I had never seen someone struggling with mental health. I guess I should specify certain mental health conditions I had never actually seen in person. So that's what led me to pursue my master's degree to really get a better understanding of what these things can look like and how I can actually be somebody that could be a helper.
Okay. So psychology is a lot about the nuts and bolts of mental health,
Hmm.
brain chemistry, brain operation,
Hmm.
which is certainly incredibly vital. Uh, Counseling is more about getting, I call it, rolling around in the mud with someone's thoughts and feelings,
Hmm.
giving them empathy and not sympathy, and trying to assist them running over the road bumps and speed bumps they encounter with life. So you could have gone on and got your master's degree in psychology, which would have been a fine thing. However, what led you to getting a master's degree in clinical mental health counseling?
Well, like you said, it's the counseling aspect was something that I guess I was drawn to because I wanted to be that person rolling around in the mud with someone. I wanted to, get down and dirty and figure out what's going on, how can I help, things like that. Whereas like if I had just pursued psychology, I may have just gone into research or may have led to another direction, but I really wanted to be able to sit one on one with people and help them help them to help themselves, I guess.
Wonderful.
Mhm.
So the difference between an undergraduate degree and entering a master's level program, there's a wide gulf there among responsibility. So could you tell us a little bit about the culture shock about getting into a master's program and finding out that they were really serious?
Yeah, absolutely. I think in a lot of people's undergraduate studies, you may find that you can sort of just coast by, whereas in a master's program, specifically in this program, coasting by is not an option. You really have to do the work. You have to be disciplined, like self disciplined. Nobody's going to be there to hold your hand and guide you through. I mean, obviously, the professors are great, and if you reach out, they'll be there. But realistically, you have to do the work, especially with the different practicums and even in just the basic counseling skills courses. You have to do practice interviews with people and stuff. So you really have to have an understanding of the material. Uh, it's not really a fake it till you make it type of place.
No, it isn't, because that can be recognized very quickly by
Mhm.
an individual who sits down in front of you. And quite often, when they're sitting in front of you, Adriana, that's not the first therapist that they've been in front of.
Right, right. People can easily notice if you start to flounder. So having that knowledge, making sure that you are staying on top of your studies will help to build your confidence when you actually do get to begin to sit in front of clients.
So, is it the job of a therapist to give advice?
No, it is not.
Wow. So, say more about that.
Obviously, I'm still in training, but in my experience so far, suggestions are always helpful. But being an active listener, showing empathy, really just being being a support to that person, I think is part of what is the most important as a therapist.
Okay, great. So, what we try to do, when we're talking to someone, we often say that we could work on character defects and weaknesses
Mhm.
for the next 6 months and things will get much worse. So, rather than starting off our first appointment with asking them what's wrong, what do you think might be a better approach, Adriana, to start off with? Tell us what's
I believe that focusing on the positives, building up strengths is more important than highlighting your weaknesses. So, if we start off by focusing on positives, what's good about life, what's good for you today, those kinds of questions to help them start to think in a more positive light.
absolutely. So, Adriana, what we try to do is find a time in their life when things were good, when things were going well. And then we want to find out the people, places, things, circumstances, and events that produced that positive outcome. And we want to try to recreate them.
Exactly. Yeah.
Okay. So, no advice, huh?
It's not always necessary. As counselors or therapists, we use techniques and different mechanisms to help create change with people, but um, realistically, they the client is the expert in their life.
I like that. So, the client is the expert in their life. Who knows their story better than them?
Nobody.
Absolutely. So, what we try to do, or what you're saying, is that we try to help point out blind spots to people.
Yes, like the Johari window that we discussed.
Yes,
Mhm.
yes. So, we're trying to point out blind spots to them. That sounds like a bit like you may have to gently challenge them, Adriana.
Yes, challenging clients is a technique that we use that definitely takes some practice. You don't want to come off too strong, but like you mentioned, gently challenging people to even question their own thoughts and beliefs. It can really be enlightening for them.
Yeah. So, what you're saying, I hear you saying, is that you're asking them to step outside and look at a situation rather than from it.
Precisely.
So, gee, there's many people out there who think that a therapist holds people's hands and tell them how sorry they are that they're in that difficulty.
I mean, it is important for a therapist or counselor to show empathy and understanding to a client or patient in whatever setting, but holding their hands and guiding them to the right answers, unfortunately, we're not magicians.
Okay, no, we don't have the. We do perform magic. Everyone out there knows about the abracadabra
Yes.
deal. However, could you tell us a little bit about what, in your mind, what's the difference between empathy and sympathy? I think most people confuse the two.
Sure. So, I think sympathy is what is most often shown to people, and that can sound like, I feel so sorry for you. Um, it's sort of almost showing pity, I think is the best way that I can describe it. Whereas empathy is more showing understanding and saying, I may not be in your shoes, I may not have gone through what you've gone through, but you know, I empathize. I don't know how to exactly word it, but it's just showing an understanding for how they're feeling versus
Yes.
saying, I know how you feel.
We help people to help us understand
Yes.
how they feel.
Right.
And we've often talked, Adriana, one of the most disrespectful things that a human being can say to another is, I know how you feel.
Yeah. Mhm.
And I think when I've seen you in action, I see that you talking to people and allowing them to think and feel however they think and feel.
Mhm.
Because most people, I understand, are told that they shouldn't think a certain way or they shouldn't feel that way or just to simply get over it.
Mhm. One of my least favorite lines is other people have it worse. You should be grateful for what you have. And it just completely discredits any feelings that a person may have.
So everyone's feelings are special and unique to them. And what we try to do is one of the things that we do is in order to properly treat someone, we have to have more or less of a definitive diagnosis. Although we treat people, we don't treat diagnoses. We have to know what area of the ballpark that we're exploring.
Yeah, absolutely. Without having a understanding of what exactly is going on, it can be much more difficult to focus on the issues at hand.
Right. So sometimes merely by casual observation, seeing someone on TV, having someone describe an individual to you, many people come right off the cuff and give them some type of a stiff diagnosis or tell them that they are,
Mm-hmm. Right.
tell them what they're, what's one of the words that people like to throw out? Oh, you're,
Crazy. Yes.
is that a word you're taught in therapy school?
That is the word that we are taught not to use in
Uh-huh.
therapy school. Yes.
Okay. Those words like nuts, crazy, um, they're verboten words.
Mm-hmm.
So labels identify people.
Right.
And labels, words mean something. Names mean something. So once we label somebody with something, that can become a self-fulfilling prophecy.
Absolutely.
So one of the most destructive things a human being can do is to tell them what to do.
Mm-hmm.
So we often refer, and at times we're taught not to treat people or go into areas that are outside of our expertise.
Sure. Yeah.
That would be unethical. Let's see, if I was a trained podiatrist, uh, just because I was an MD doesn't mean that I could set bones or operate on an individual
Yeah.
or pull teeth.
Mm-hmm.
Okay, so what we have to watch out is our own egos, do we not?
Yeah.
Okay,
Absolutely.
okay. So say a little bit about. Uh, Quite often, we deal with people who are in the midst of extreme emotional distress.
Mm-hmm.
Uh, that's often quite discomforting or disconcerting to someone to sit in a room with someone across from you who is melting down in sorrow and grief.
Mm-hmm.
How does that affect you?
Um, I think I would be lying if I said that it didn't affect me, that I haven't been in certain situations that have moved me emotionally as well. And it's absolutely okay as a counselor to feel that emotion yourself, as long as you are honest that you're not using any transference or counter transference in those kinds of situations. But sure, there have been times that have been very difficult for me to sit through.
So, when we're talking about transference and countertransference,
Mhm.
perhaps you could explain that a bit.
Sure. So, and forgive me if I mix these up. Maybe you can correct me. Um, transference is when a client transfers some kind of emotions that they are holding towards someone in their life onto the therapist. So, for example, say they had a tumultuous relationship with their father, they have a therapist that is an older gentleman, they might kind of transfer those sort of emotions or feelings or thoughts onto that therapist. And then countertransference is the opposite, where a therapist transfers any type of emotional feelings that they may have onto the client.
Wow,
Right.
excellent.
Mhm.
So, what you're saying is that the therapist has to be aware to have some boundaries between themselves and the patient, or they'll become ineffective.
Absolutely. We always emphasize awareness to our clients, but awareness in ourselves is important, just as
Yes,
important.
yes. So, what is this business about positive self regard?
positive self-regard.
Yes.
What do you mean exactly?
Well, it's when what we do is we always accept the person, we don't accept the behavior.
Right.
Okay?
Mm-hmm. Yeah. Being accepting of a person that we're working with, or even with ourselves sometimes, having that acceptance is important. But what we're aiming to do is change behaviors or help modify behaviors in a way that is more functional for the client to have a more positive life.
Okay. So what we're looking for, what you're telling me, what I'm hearing you say is we're asking people to take emotional mind choices and turn them into wise mind choices.
Hey guys, we're having a great conversation here, and I hope you guys are following us, and I hope you guys are subscribing to our Patreon at patreon.com/fishwithoutbait. We're going to be putting some exclusive content out there, and you can help support this show. But we are going to come back next week with the rest of this conversation when Jim and I continue this chat. Thank you guys for listening.
Please check out our website at fishingwithoutbait.com, where you can listen to the show, comment on our discussions, and find out where you can subscribe to our podcast.
If you're interested in flying the colors of Fishing Without Bait, click the shop icon on our website. We have clothing, mugs, cell phone cases, and so much more. Show the world that you fish without bait.
This show is a member of the Sorgatron Media Podcast Network. Find out more at sorgatronmedia.com.